Hi, my name is Tiffany Poteet. Thank you for joining us for Skin and Surgery. I'm a board-certified plastic and reconstructive surgeon.
And I'm Tiffany Poteet. I'm a board-certified nurse practitioner, and we're married, and we live and work in Marysville and Worthington, Ohio.
In our first two episodes, we explored the connection between skin health and overall health, and today we're going to talk about a surgical topic, which is skin removal. And these are real common procedures that we do for a variety of different reasons, and we thought it would be an interesting topic since it's something that has become more popular. So hope you enjoy.
It's a popular topic right now with the GLP-1s and injections that patients are using to lose weight. And we often see these patients after they've lost the weight or had bariatric surgery and lost the weight, and then they come to us. One part, they're really excited because they've lost all this weight. They feel like they're getting their quality of life back. But then another component, they're still frustrated because they have this excess skin that they can't do anything about despite exercise, despite, different therapies that they've tried. At what part do you start to say, hey, you're actually a surgical candidate for skin removal?
That's a great question. It really is different for each patient, but there are definitely some criteria that are important to consider. One that's probably most important is we want patients to be at their goal weight and where they're happy with their weight, they've finished that weight loss process, and so that's really the optimal time to consider doing these skin removal procedures.
So tell us a little bit about when you started doing these procedures for skin removal and why you do them.
Well, I started these procedures when I was working at the university, and we would take care of a lot of patients who had been through the bariatric surgery process and had a lot of excess skin. So there was really a need for what we call body contouring. That's how I got into these operations and really got a lot of experience doing them early on in my practice. And what I really discovered is that I enjoy doing these procedures. The reason why is really related to the improvement in quality of life that these patients experience after surgery. There's been a lot of research that's been done showing the connection between skin removal surgery and improvement in quality of life. There was a great study actually in 2012 that looked at this in the American Society of Plastic Surgeons for patients who underwent skin removal, and it showed a substantial increase in a number of different categories. There was an improvement in physical function and appearance, an improvement in mental well-being, social acceptance, even intimacy and sexual health. And so over the past decade or so, there's really been study after study that have showed this great connection between skin removal and improvement in a patient's quality of life.
So how long have we been doing skin removal surgeries? Is it a fairly new concept, or have we been doing it, ever since bariatric surgery?
These operations have been around for a while. I would say they probably started more in the cosmetic realm. You think of a tummy tuck or an arm lift or even a face and neck lift. Almost all of those cosmetic procedures involve skin removal and tightening. So I think they began primarily in that realm, but as obesity became more of a problem, especially in Western society, and then the weight loss surgery really took off probably 20 or 30 years ago. That's when it really became more prominent in plastic surgery to do a lot of these skin removal surgeries. So it's been around for a while. The techniques have changed some, and we've learned a lot in terms of what works well and the safety and outcomes research. But it's they're not really new in that sense.
Would you say that tummy tucks were the first procedures done for skin removal?
I think so. I think that's probably the most common, operation that was done early on. And that's certainly been going on for many decades. So yeah, I think you're probably right.
Could you explain the difference? So a patient comes to you after a massive weight loss. And whenever we say massive weight loss, about how much weight are we talking about?
It can vary for each patient, but in general, it's anywhere from 60 to 80 pounds all the way up to, 200 or more pounds. So it's really different for each patient, but it's a substantial amount of weight.
Okay, and I should add too, it's not just bariatric surgery or GLP-1s that patients come to us after massive weight loss. Sometimes it's lifestyle changes. Sometimes it's, multiple pregnancies that have led to this excess skin. But could you explain the difference between a paniculectomy and a tummy tuck? Because I feel like those are terms that are thrown around, whether a patient's having a paniculectomy versus a tummy tuck.
That's a great question, and there are some important differences. And it's a good point that you made about weight loss. Yeah, patients come to us for weight loss of all different reasons and for cosmetic reasons. Patients who maybe haven't lost a lot of weight, or they've lost weight over time through diet and exercise, and they just have excess skin for a variety of reasons. And so we do a lot of patients' tummy tucks for that reason, arm lifts, thigh lifts, breast lifts, and a variety of other procedures. The difference between a paniculectomy and a tummy tuck is really a technical one. Also, whether it's something insurance is going to cover or if it's something a patient is doing that's out of pocket. Traditionally, a tummy tuck involves removal of the excess skin that hangs over the waistline. So it's the part of the excess skin that tends to cause most of the issues with skin rashes, skin infections, and other hygiene issues. And that's really what insurance primarily will cover for patients who have lost a lot of weight. A tummy tuck includes that, but also includes removal of excess skin in the upper abdomen, tightening around the belly button, tightening of the abdominal muscles, and really a full shaping of the entire abdomen. But it's a cosmetic procedure as well. So sometimes insurance will cover part of that, but almost always it's a self-pay portion of the procedure to really get patients that optimal cosmetic outcome with a tummy tuck.
We often associate the skin removal surgeries with just to achieve a certain aesthetic look or just strictly a cosmetic surgery. But you're absolutely right. A lot of times patients come with symptoms that are interfering with their activities, with certain clothes that they're wearing. So it could be rashes, it could be, smells that they're experiencing. And it's really distressing to the patient. So I often talk to patients that come in for consultations that are frustrated because they've lost this weight via lifestyle changes, via GLP-1s, via bariatric surgery, but they're still having to buy maybe the same size pants because of all the excess skin that's hanging off. And losing the weight is only part of the circle. To come full circle, you have to remove the skin as well. There is nothing that you can do that's going to cause the skin to rebound. So it's not the patient's fault that they're not exercising enough or not eating right, that they can't, get that last piece of the puzzle. It's truly excess skin that has to be surgically removed. And that brings us to the full circle of the treatment. And I do think we're doing better having a conversations with patients on the front end saying, hey, yes, we'll do the surgery or we'll start the medication, but just so you know, there will be that component of skin laxity that will have to be addressed surgically.
I think that's really well said. It's definitely a journey for these patients, and the weight loss is a huge part of it because it involves such a transformation. And these patients often get such an improvement in their other health problems, like their diabetes and high blood pressure and some of these other things that go away, but then they're left with this excess skin. And so that's we're able to help them complete that journey by removing a lot of that excess skin. And we have so many patients. One of the things I love is patients that come back after surgery and they talk about how they're able to wear a bathing suit again and go to the pool or the beach and feel better about their self-image, or they can exercise without the discomfort of having, excess skin get in the way of doing certain activities. And so really, it's that full circle, journey that I really love being a part of for patients. And we're a part of it. There are many other people involved in that journey for each patient, but it's great to be, able to help them, finish that process.
Let's talk about all the places that you do the skin removal.
So there are a variety of different options. The most common one is the trunk. So that would be the abdomen or the stomach, where we do tummy tuck, the paniculectomy, which is more of that medical procedure. The next most common is probably the breast area, where we would do a breast lift or what's called a mastopexy. And then probably the arms, where an arm lift or brachioplasty would be performed, and then the thighs. Other really common areas would be the face and neck. Those are often done for cosmetic reasons primarily. And then there's some other kind of outliers that are not quite as common, where we would remove excess skin from the back or from the sides, and everyone's a little bit different in terms of where they develop most of that excess skin. But it's primarily, I'd say, most of the procedures that we start off initially are on the abdomen.
Let's debunk a myth that the skin removal surgeries are done primarily for women.
Yes, that is a myth. We take care of plenty of men, and the procedures can be a little bit different between men and women. For example, men often have a lot of excess skin and tissue on the chest, and so there's different techniques and options that we do there to address that. But that is a good point. We take care of men and women and do a variety of different operations for both.
So post-op recovery for patients that have undergone skin removal surgery, it's typically 4 to 6 weeks of activity restriction. We have patients that will go back to work after a couple weeks, but obviously no lifting, pulling. If they're sitting at a desk, that's fine. Post-op day 1, we love our patients to be up and walking. They will have to wear compression garments for about 4 to 6 weeks, depending on the swelling. We'll see them post-op, usually about 1 week post-op. And then, listen, Stephen doesn't like to let go of his post-op patients, so we see them quite frequently. Sometimes patients are like, do I have to keep following up?
Well, there's a couple reasons for that, but yeah, you're right. I mean, we do see patients often. I like to make sure that as they're healing, the swelling is going down. We talk a lot about scar management and how to optimize scar healing, so we get into some of that, plus lymphatic massage techniques. So it's definitely a process, and it can take even up to 3 to 4 months before that final amount of soft tissue swelling is gone. So it's not a quick process in terms of getting to that final outcome from a cosmetic standpoint, but I do like to see our patients back even up to a year out, because we really can tell the difference once those scars have fully softened and faded in color.
I think most patients are surprised by how little pain that they experience postoperatively. I would say, in order of pain severity, tummy tucks, they tend to rebound rather quickly. So they might be on pain medications for a couple days post-op, and then it's managed well with Tylenol. And
it is a good point. A lot of patients ask about pain after surgery, and I think there's a couple reasons why people tend to be surprised. One is the nature of these operations is pretty basic. It's skin removal. We're not, typically going through muscle layers or doing things that are more invasive, and so it tends to not be too painful from that standpoint. The other thing that's really helped in the past few years that a lot of surgeons are using is a medication called Exparel, which is a long-acting numbing medication that we inject into the surgery sites, and it can last up to 3 or 4 days. So it makes a substantial improvement in pain after surgery. I even have a lot of patients that don't even take pain medication in those first few days, and then really end up just taking Tylenol or ibuprofen or something else.
I think it's the surgeon's gentle hands.
Well, I wish I could take credit for that, but no, I think it really... there are a lot of improvements in the anesthesia process and different medications that patients use to help offset that pain. But it's the nature of these surgeries tends to not be too much.
So what would you say would be the most painful surgery, or maybe the longest post-operative recovery?
I think a thigh lift. Anything on the thighs, whether it's an excision or a lifting or liposuction, those are always the most difficult in terms of postoperative pain, the duration of the swelling and recovery. And so a lot of patients still are really happy after that procedure, but it's just a little bit more involved in terms of the recovery process.
Like beyond 6 weeks, would you say?
I think the swelling, in the legs tends to last longer. It can be up to, 2 to 3 months even. And it's definitely little more of a process than, say, a tummy tuck or breast or arm surgery.
Let's talk about ideal candidacy. Patients that have been stable with their weight for the past 6 months and they're at their goal weight, so they're not continuing to lose. Patients that are not smoking because it can really impede the healing process. Or if they are a smoker, how long do you typically like your patients to wait to have surgery?
Usually, we don't want anyone to use tobacco or nicotine for at least 4 weeks before surgery and 4 weeks after. It's really the nicotine that causes the increased risk for healing complications and infections around the time of surgery.
They need to be in a good place nutritionally with their protein levels, their vitamin B12.
Right, and their iron levels. Just making sure that nutritionally they've recovered from that weight loss process. We definitely don't want to operate or do these procedures on patients who are anemic or who don't have, good protein levels, which you need for optimal healing.
In aesthetics, whenever we're talking about the face, we always say asymmetry exists and persists. Would you say that that also applies to the body post-op? So say you've just done a tummy tuck. Do you prep the patient to let them know, hey, there might still be some asymmetry?
No, that's a great point because our bodies are not perfectly symmetric. They are, in general, symmetric, but there are definitely things, and I really try and point out to patients before surgery, is that asymmetries are present and they can persist after surgery. We try to correct a lot of those, and they're actually things that we do during surgery. One, I mark patients preoperatively, and we measure and really try to make all of the incisions as symmetric as possible. But when you're removing so much tissue, it can be hard, especially as patients heal. Things will not really ever be 100% symmetric. And so I tell patients that with things like a facelift or a neck lift, it's much more easy to be precise because we're working with a smaller area that we're not typically removing as much skin. When you're talking about a tummy tuck or a thigh lift, where we're taking out a whole lot more tissue in a greater surface area, then there's a lot greater chance for those asymmetries. And I usually tell patients too that it's very common to do minor revisions or touch-ups down the road. We don't do that on everyone, but I'd say probably 10 to 15% of patients come back and we do a minor touch-up or revision of a scar or make things more symmetric down the road. And that's a very easy thing that we can do, sometimes in the office or sometimes in the operating room.
Would you say that skin removal surgeries, it's a one and done procedure? So once a patient has a skin removal surgery, would you anticipate that they would require a revision down the line?
Typically, it depends on the patient. So for a cosmetic patient who's coming in for a tummy tuck, I would say no. Usually a one and done is what we're trying to achieve there, a great cosmetic outcome, after the initial operation. For someone who's lost 100 or 200 pounds, it's much more likely because that skin that is left after we've done the skin removal is already kind of lost its natural elasticity. It's not. It will stretch a little bit more, and there's just so much tissue that we're removing that it's very common to come back and do a revision down the road or to add something later. So it kind of just depends on whether it's more of a cosmetic procedure from the beginning or whether it's someone who's lost a lot of weight. Which patients do you think are the happiest that we see after these operations?
Oh man, all of them. But I would say probably patients after having a tummy tuck because they feel like they've regained some of their body back and they can actually wear pants that fit them and they don't have to go a size up just to help accommodate all the excess skin.
Yeah. There have been a few unusual requests that I've received over the years, and so I'd like to address those head on. One is, although it would be great, we cannot use your skin to donate to another patient or use it in medical research. There probably are some places where you can do that, but right now the technology isn't there. The other thing that's pretty unusual, I've had patients ask a few times, is can the skin be used to to make something like a handbag or a purse, and that is just absolutely out of the question.
No. Whenever you're doing the skin removal surgeries, you're removing some of the subcutaneous tissue. Is there anything that you can do with the subcutaneous tissue to restore some of the volume lost in other places? So whenever we lose weight, it doesn't discriminate. We lose the fat off of our face. Can you do any fat grafting with that tissue?
You can, and that's a great thing to highlight. When we remove the skin, we're also taking off a lot of the fat, or what we call the subcutaneous fat, that exists between the skin level and the muscle layer. And we can use that fat for other purposes. It can be taken from one part of the body. It can be what we call fat grafting, which is where we take the fat, we wash it, we kind of put it into smaller components, and then it can be re-injected into other parts of the body to restore volume in the face. So it's commonly done during a face and neck lift procedure. It's also done during eyelid or eye rejuvenation, such as a blepharoplasty, and then it can be used for other medical reasons as well. We use it a lot with patients who have had breast cancer, who have had breast reconstruction, and we're trying to add volume to the breast area or smooth out areas that are irregular. And fat grafting is a great option for those patients.
Well, I think that it's a lot more natural looking, and patients are more willing to have fat grafting opposed to injectables because it's their own body.
Right.
So there's less of that risk of rejection and...
Right. Yeah, it's your own tissue. So yeah, it feels a little bit more natural.
However, it's your own tissue, but it's abdominal tissue. So if you're removing it from the abdomen, so it's going to act a little bit different than facial fat. So whenever you do fat grafting for the face, I've heard that, if a patient gains weight, then the fat that's grafted onto their face is going to respond a little bit differently than...
Yes, and that's true. It can. Typically, it's not an issue, but for patients who were to gain a lot of weight, yeah, that fat can definitely increase in size. So you could see some changes there. That's why
it might look a little unnatural.
It might. That's why it's really important to do these operations at
Can you inject it into your lips? Please say no. Please say no.
No, we do not. We do not do that. We also do not inject it into the posterior, which is otherwise known as a BBL. Not broadband light, which we talked about in our first episodes, but the Brazilian butt lift.
But that's done, right?
It is done. There are patients who ask for that. There are surgeons who do those operations and do them really well. They do have a high risk of complications, and it's just not something we offer in our practice. And so those patients I usually refer out to another surgeon if they're really interested in that. One thing I did want to highlight about these procedures that I really enjoy seeing patients experience is once the skin removal is completed and they really see that improvement in their quality of life, it actually leads to more healthy living. So these patients are getting back to regular exercise or getting back to hobbies and other things that they haven't been able to do for a while because of the limitations of having all that excess tissue. And so it really relates well to what we try to aspire to in our practice, is restoring that sense of wellness and wholeness for people, and just really enjoy kind of seeing patients experience that.
The name of our practice is Ohio Plastic and Reconstructive Surgery, and we have offices in Worthington, Ohio, and in Marysville, Ohio. You can find out more information about the services we offer and a little bit more about us and our practice at our website, which is www.ohioprs.com. Also, you can feel free to contact us anytime. The best email to do that is info@ohioprs.com. You can also find us online. Our Instagram handle is @OhioPRS, and you can also find us on Facebook.
And thanks to Maggio for providing the music and production for this podcast. A link to their information is provided in the description.